Good evening, everyone. My name is Beth Dunphy, a Deputy Executive Director here at Goddard Riverside. I'm delighted to welcome you to this timely conversation about the coronavirus pandemic between Carolina Cortes-Rivera and Dr. Irwin Redlener. This is the last in a great series of conversations from our Social Justice Never Sleeps Gala. Last week, we had a fascinating conversation between our Executive Director, Rod Jones, and Manhattan Borough President Gail Brewer. If you missed it, I highly recommend watching the recording. This will all culminate with our virtual gala next Thursday, October 29th. I hope you can join us. At the gala, we'll be announcing the winners of our social justice book prizes for both youth and adults. We announced our shortlist earlier this month. It is 10 great reads covering a wide range of issues. I encourage you to check them out. Details for all the conversations, our gala, and the book prizes are all available on our website or by clicking the banner right at the top. I'd also like to shout out some of our sponsors for the gala and this speaker series. Two of our biggest are Penguin Random House and Workman Publishing. These two houses also support our community in a variety of ways throughout the year, from volunteering to toy drives. We're so grateful for their ongoing partnership with Goddard. Before we bring Carolina and Irwin on stage, I've got a few housekeeping announcements to share. We can't see or hear the audience tonight, so you don't have to worry about accidentally turning on your mic or camera, but we hope you'll engage in the conversation in the chat. Please, we'll take audience questions at the end, but you can enter them throughout the presentation. Keep in mind, there's a slight delay, about 30 seconds in the video, and if you're joining us a few minutes late, the event will start from the beginning, so you won't miss a thing. If you have any technical difficulties, there's also a support tab where we can help you troubleshoot. You can also adjust the sizing of the chat section or the video by dragging the gray edges of each section, and if you hover your mouse, some controls will show up, allowing you to make the video full screen, pause the action, adjust the volume, or even pin a small video to the corner of your screen. Now, without any further ado, I'd like to introduce Carolina and Irwin. Carolina Cortes-Rivera is a student from our Options program, which helps New Yorkers get into and complete college. She is currently a junior at NYU, interested in the intersections of health and social justice. She's also a policy intern for Degrees NYC, a collective impact project fighting for equity in college access and completion. And Dr. Irwin Redlener is a recognized leader in disaster preparedness in response to pandemic. He is the director of the Pandemic Resource and Response Initiative at Columbia's Earth Institute. And he also has more than 3 decades of experience providing healthcare to medically underserved children. He's the co-founder and president emeritus of the Children's Health Fund, which brings high-quality healthcare directly to children and families where they live, learn, and play. Please join me in welcoming Carolina and Irwin.
Hi, Irwin. How
Hi,
are
Carolina.
you tonight?
Good.
Yeah, so I'll just tell you a little bit more about what I do with Degrees NYC. I'm the policy intern, as Beth mentioned before. Degrees NYC is a collective impact initiative that was started in 2016 and focuses on educational equity primarily in the post-secondary space. Definitely keeping in mind that students face systemic barriers in matriculating and obtaining a post-secondary degree as early on as pre-K. So a lot of the work that Degrees NYC does is encompasses the educational system as a whole from grades K through 16. Do you want to tell me a little bit more about what you do with the Pandemic Resource and Response Initiative at Columbia?
Sure. So I've been working on disasters really since the 1970s. It's actually more than 3 decades. I'm sorry to say, or I'm happy to say, whatever. But yeah, and I have been working as a physician, as a policy person, and as an analyst, trying to figure out what the best practices are for different kinds of disasters. But I've been involved in response and policies around response to earthquakes and hurricanes and terrorism and every other kind of disaster you can think about. And and I founded the National Center for Disaster Preparedness at Columbia's Earth Institute back in, it started in 2003 at the School of Public Health at Columbia, and then was moved 10 years later in 2013 to being housed at the Earth Institute. And the Earth Institute has been focused on research, practice, and policy with respect to disasters. And it's very complicated, and it's relatively new that academic institutions have gotten into disaster response. So I think our center has become an important voice in that field. And so when the pandemic occurred, I started thinking and writing about it back in early February. And at that point, I was the senior advisor to Mayor de Blasio about disaster response in general. And I was on television quite a bit. And sometime in the middle of March, I was asked to join NBC and MSNBC as a spokesperson, on-air analyst in public health. So the programs that we're doing have to do with research and policy, and also direct aid to people in communities that have had a particularly difficult problem with COVID. And we've gotten a fair amount of support from the Singer Share, from Joan Baez, from a number of foundations and individuals. So what we do is we help provide direct relief when needed, which includes PPE, personal protective equipment, and we may provide testing capacity or staff or other things that are necessary for communities to cope. But we also spend a lot of time thinking about the messaging for COVID and how to best advise families and individuals about what they need to do. But like so much else in my career, it doesn't stop with working on policies or advocacy in the traditional sense, in that I think you can't really do advocacy if you're not doing politics. And I mean, there's limitations, obviously, as a not-for-profit organization, a so-called 501c3 corporation. I know many of you are familiar with what that is, and you're not supposed to be able to do direct partisan politics. I can't tell people who to vote for.
Mm-hmm.
And I try to sort of follow that rule at least, but we can do things that will help create an environment where it's obvious who's doing the right thing and who isn't. And just today, just to round this out, we issued a report that says of the 217,000 people that died from COVID as of last Friday, somewhere between 130,000 and 200,000 of those 217,000 people could have survived if we had the correct policies. And that's a very sad statistics, but we used international comparisons to figure out what could have been our fatality rate if we did things the right way.
Definitely. As I know that you mentioned that the Pandemic Resource and Response Initiative is involved with the community. I was just wondering, how do they go about distributing resources with community members? What kind of outreach do you do?
So our staff does a lot of researching and where the hotspots are, and trying to make connections with people who can give us more specific information about, where there are big needs. For example, we've provided resources to 5 community health centers in Central California, where there are significantly indigent communities that are trying to serve the interests of farm workers in Central California. And that's just an area that's got a lot of problems. But when COVID hit, everything was affected, of course, by by COVID.
Definitely. I know that you wrote a book back in 2006 about how unprepared the U.S. was for mega disasters. Can you talk about some of those systemic failures you wrote about? I know you mentioned it a little bit before, but could you go into it?
Yeah. So that book had a very specific point. And when it came to very large scale disasters, what I called mega disasters, we were really not prepared for many scenarios. And the book goes through a lot of different scenarios and tries to point out what kinds of things made me think that we were underprepared. And then a good part of the book goes about defining what we needed to do. But I should say, relevant to our current situation, there's a scenario in this book that was written, 14 years ago, about how a pandemic might develop and spread in New York. And that scenario turned out to be predictive of the situation we're in right now.
Definitely. I can imagine how much insight could be in that book, but like, what would you say it would have taken to remedy like those problems that you talk about, like say 5 years ago?
Well, there are a lot of issues in terms of what our political leaders understand to be the challenges in a very specific way, and how much it would cost to fix those or deal with those challenges. So just take infrastructure. So we have lots of levees and dams around the United States, a couple of thousand of them that are really not safe, that with a certain kind of storm, or let's say a coastal hurricane, those levees would give way. And so investing in infrastructure is something that's really very important. And the stability of the electrical grid. If the electrical grid goes out, we have all kinds of big problems. So there's lots of details in that book, like if you live on the West Coast and you're subject to earthquakes on a relatively frequent basis, is your community prepared? Is your electrical grid structures, are they capable of withstanding a solar storm or a cyber attack? And the problem is that we're not very prepared for things of that nature at all, nor are we for the pandemic.
Yeah, I would say that this pandemic has definitely disproportionately affected some communities more than others. Could you tell me about like which communities have been most severely impacted and why?
Yeah. So the distribution of COVID-19 among the population is not equal. That Black and Hispanic communities have been hit very hard for a lot of reasons. One is a lot of them are doing essential work, working in restaurants and transportation systems and so on. And also there's a high prevalence of obesity and other risk factors among these populations. And third, these are people who don't have good access to medical care to begin with. So all those factors clumped together has made it very difficult for those people who live in those communities, but it also exacerbates the inequity of access to health care that low income and certain minority populations experience.
Yeah, I would say that this pandemic has definitely, like you said, exacerbated a lot of the conditions that already existed in these communities, and really like shed light on like the access to food that certain communities have, like you said, that creates situations in which like things like obesity are so prominent. So everything is so intertwined. Do you think that these issues could have been prevented? Like, how do we remedy these issues moving forward? Because yes, we can. A few years from now, we will be able to say that we moved on from COVID, but these health disparities are still going to be existing in my community, in the communities that you're talking about.
I know. So this is why I mentioned politics in the beginning. So in general, advocates who are dealing with an issue, like let's say you want to have more funds for more community health centers in a particular area, that's a tough uphill battle. Unless, of course, you have a receptive Congress that's willing to appropriate the money. And I think that clarifying who's able to do what and the importance of who we have in office makes a big difference. So if there's people not representing your interests, then you're not going to get anything done. And it's very rare that we have science or evidence making a difference in policies or funding. So, if I told you that homeless children have tremendous needs. They're not getting fulfilled. They need health care and they need a better education, better schools and all that. That's fine, but that money is not going to materialize unless you're able to wield political power, which is something I'm actually pretty focused on.
Right. Which just goes into how, like, a lot of these communities are disenfranchised, right? Like, a lot of the politics that exists on, like, who is able to, like, vote for people in Congress is very intentional. Could you actually tell me a little bit more about the Children's Health Fund? Because I feel like that definitely relates to what we're talking about.
Yeah. So in 1985 and into 86, there was a terrible drought in sub-Saharan Africa. And I think in the winter of 1984, a British rock and roll hero, whose name I'm blocking at the moment, but Bob Geldof, created a mega event called Live Aid. And they raised a lot of money for famine relief in sub-Saharan Africa. And then a number of American singers and songwriters like Lionel Richie and Michael Jackson wrote this song called We Are the World. And We Are the World was a mega hit, raised almost $60 million in 1985. And through a process that I wasted time to talk about, really, but I ended up being the medical director and director of grants, and I was on the board of USA for Africa. And so I was in charge of overseeing the process for distributing the money that was raised by We Are the World. But does We Are the World ring a bell to you?
No,
Caroline?
it doesn't.
Wow, this aging process is no good. So if you can imagine every single A-lister, singer-songwriter today,
Yeah.
and they all went into a room to a secret recording session where two of the best songwriters of the day had written a song and they recorded it, like 50 of them. Literally everyone you could think of in all genres, from rap to country to whatever it is. And they wrote this song called We Are the World. If I had a better voice, I would actually sing it for you. But I strongly suggest you Google it.
I think I know the song, but
Yeah.
I'm not 100% sure.
Yeah.
I think.
So one of the singers is a very famous singer-songwriter named Paul Simon. And you probably don't know much about him either. But he's a cultural icon songwriter. Anyway, he was one of the singers, and he lived in a neighborhood in New York City with a lot of homeless people. So he wanted to use some of the money raised by USA for Africa and help homeless people. And USA for Africa main office referred him to me, and I took him on a tour of shelters for homeless families in the fall of 1986. And then Paul wanted to know what he could do. And I said, well, I'm a pediatrician, and I think these children need health care. And I came up with the idea of using a mobile children's health clinic. So a fully equipped, self-contained, rolling health center that we could drive wherever we wanted in the city, which is what we did. And Paul raised the money for that thing, and that became the Children's Health Fund. And then that actually got launched as a program in 1987. And since then, we've developed 53 of these mobile clinics that are all over the country now in rural and urban environments. And so until 2 years ago, I was a co-founder with Paul Simon, but also the president of Children's Health Fund. And I stepped down 3 years ago. I hired somebody to replace me. And but the Children's Health Fund has seen almost 5 million healthcare encounters since it was founded. And it's very active in many of these communities where there are real struggles to get access to healthcare. And all the children taken care of there they're either homeless, or they come from extremely poor families, or they've had real problems accessing healthcare.
Yeah.
That's the Children's Health Fund.
Could you tell me more about those problems? I know, like, or I feel like we're talking really abstractly about like what those problems are. Could you like mention like what those barriers are that are barring people from getting
So
health care?
these are generally called the social determinants of health, meaning what are the things that people live with that end up having an effect on their health or access to health care, the social determinants. So poverty, racism, um, all sorts of upstream challenges from living in communities with bad water and bad education. All these things contribute to an unhealthy state for children and families who live in those communities. So that's basically what we've been doing, is trying to deal with those barriers as best we can, but they're often non-medical barriers. So people that have worked with us, we've helped train to be sensitive to what the barriers to care are and what is it that you can do as a doctor or some sort of practitioner, in a medical practitioner in some sort of underserved community. So that's what we've been doing. And we've ended up, as I say, seeing about 5 million children over the years, and quite gratifying, but it's a very challenging idea.
Yeah, I can imagine. Does the Children's Health Fund extend services to undocumented children and families?
Sure. If they are in these communities that we're trying to help, yeah, of course, and we don't charge anybody. And it's all comers and nobody gets denied. But yes, so our programs in Texas and California, and sometimes even in New York, do end up serving undocumented people and children.
Yeah. Just going back to COVID and the current situation that we're in, what do you think the long-term impacts will be on Black and Brown communities?
So I wrote a piece called The Pandemic Generation. It was an op-ed in the Washington Post. Maybe Elizabeth or somebody could find that piece and just send it around in the chat. So it's Washington Post, I think it was May 12th. And I wrote it with Karen Redlener, my wife, and we described the answer to what you just asked. What's going to happen to these children, and what about children who had been chronically disadvantaged, chronically not getting access to services they need, which include health care and a quality education and all that. And yeah, it's been pretty much on my mind, like always. This has been my whole career.
Earlier in our talk, you mentioned the number of deaths and rates of infection that have occurred globally. Why would you say the U.S. has been more impacted than other countries?
Because Donald Trump is our president, and he has been promoting policies that are reckless and crazy. He's been undermining and publicly defaming the medical scientists and doctors who should have been front and center, who he basically makes fun of. He set a role model of somebody who's defiant of public health practices and who has basically lied to the public every single day of his presidency and has created confusion and chaos in the United States about what we should be doing. And as a consequence, we have less than half of all Americans who think that who tell pollsters that they regularly wear a mask. Trump's made fun of it. He's had, in essence, super spreader events for the entire time with either campaign rallies, people crowded around, not wearing masks. He doesn't wear a mask. He's mocked people who wear masks. And that's it. And as long as he's president, this is not going to get fixed.
So what would you say the U.S. could have done better in the earlier days of the pandemic?
Oh, we could have had a lot more testing. We could have had contact tracing, where you find people that are positive and you speak to them and you figure out who else they've been in contact with and find those people and, do testing and do follow-up. We could have been much more assertive about what's called NPIs, non-pharmaceutical interventions. So since we don't have the medication to treat most people, we could have had mandates that require people to wear masks and protect themselves and others.
Definitely. So what about right now? Is there anything that we should be doing in particular moving forward?
Yeah, you mean other than on November 3rd?
Yeah.
Yeah. Yeah, everybody should be wearing masks, should be practicing social distancing and careful hand hygienes, and we shouldn't be going to bars. And, I'm concerned about people, gathering in restaurants also, and we're getting to the winter, so the ability to eat outside is going to be changing, obviously. So, if we don't have federal leadership for a big national, international crisis, what we are actually able to do is way more limited than it should be, and it is a problem.
Yeah. So, like you said, since winter is upon us, right? It's getting colder out, and I know that some restaurants are making plastic pods available for people to eat in during COVID. Are there any safer options for indoor dining?
New Zealand, I don't know, Taiwan, there aren't, but no, for eating indoors.
Yeah.
Well, what I had been proposing for months now is that we shouldn't be opening restaurants unless diners are separated sufficiently, and that the restaurants function at no more than 25% capacity. That we're able to do testing on everybody, including people that work in the kitchen, the wait staff, and so on, and that we're taking people's temperature maybe when they're coming into the facility. But there are things that will allow businesses to function. But I know you think I'm harping on this, but if we don't have national leadership saying this is the way we can safely go back to restaurants or bars or other places which have been otherwise denormalized, then it's a problem.
Yeah. Would you say that there's a particular country or region that has handled the virus well?
Well, you talking about other countries or other?
Yeah. Like, is there
right? So the report that we issued today was specifically a head-to-head comparison of fatality rates in various countries, and we took the best out there because we're not going to model ourselves on the poorest performing. So we looked at the fatalities per 100,000 people in any given country, and here's what we came up with. So Japan and Singapore have fatality rates more or less 1 per every 100,000 people in their population. Canada, 33, and many other states sort of in between there. The United States has had 66 fatalities per 100,000 population, which is about 66 times what is seen in Japan and South Korea and some other countries. So what they did, which is really all this study was about, they had enforced mask wearing. They had common understandings about how many people could gather at any one time. They closed schools and businesses very early, and that's it. They didn't have any magic medication. They just did what they needed to do from a public health point of view, and it seems to have worked.
So let's talk about the vaccine. Actually, are there? I know that there are several vaccines in trial. What do you think we'll have? Like, when do you think we'll have a vaccine by?
So we'll probably have a couple of vaccines that get what's called emergency use authorization by the FDA, the Food and Drug Administration.
Yeah.
And we had 4 companies. There were dozens of companies working on this, but the 4 that were in the lead, 2 of them had to go on pause for the vaccine trials because volunteers got sick and they don't know whether it was from the vaccine or just coincident. But we probably will have an effective vaccine, maybe safe effective vaccine, by the end of the year. But we're not going to have it in huge quantities. We have some number of millions of doses, let's say by the end of the year, but the priorities are going to be frontline health workers, other essential workers, and so on. But by the time it gets into general circulation, where we can give it to everybody, which is what we should be doing in terms of vaccine development timeline, we'll be into end of 2021, beginning of 2022, in my opinion.
Yeah, and how long do you think enough people, how many people would it take for the vaccine to actually stop the spread of the virus?
So you're talking about the herd immunity idea? So probably something in the order of 60 to 70% of the population would need to have antibodies to the disease to create this environment of what we call herd immunity, where, just it's not enough people to spread it around to. So there's two schools of thought on this. One is to develop a vaccine as quickly as possible, give the vaccine to people, they'll have antibodies, and that will sort of help bring it to a halt. The other idea is letting people just get the disease, let it just run rampant in the community and see what happens. It's something which I find offensive and stupid, and I think we're in a situation where, if we did say we're going to do natural herd immunity, in other words, let it spread around the community and people will build up antibodies, that would cost several million lives in the U.S. And I think it's a stupid idea. Really.
Yeah, additional lives that could have been prevented. Can you talk about the logistics of actually distributing that vaccine to so many people, especially since people are going back to work, back to school?
Yeah. Well, three of the main companies that will be manufacturing the vaccine, if they can get around the hurdles and the mishaps and so on along the way, have a regimen that requires 2 doses of vaccine, one and then another one 3 or 4 weeks later, which makes it incredibly difficult, as does the fact that these vaccines need to be stored at minus 110 degrees Fahrenheit. So incredible challenges with what's called the cold chain. In other words, maintaining these very low temperatures from the time they leave the factory, being transported, being unloaded, being delivered to the communities or the pharmacies where it's actually going to be given. And establishing that cold chain, which you must have, otherwise those particular vaccines will get destroyed if they get warmed up. So that's where we are right now, and that's a major challenge.
Definitely. I know, like you mentioned before, the Children's Health Fund has a doctor's office on wheels. Do you think that might be a tool to actually help with the infrastructure in terms of
Yeah, it could be, but they don't have the capacity to sustain that level of cold temperatures that they would need to do.
Okay, makes sense. So what are lessons learned from all of this, from the pandemic, and as we move forward with a vaccine?
What are what? I'm sorry.
Lessons learned.
Lessons learned. That we have to be honest with ourselves. We have to have people that are working on this that are geared up to to determine when we have early introduction of a new pandemic virus. We have to be ready and waiting to develop new vaccines at that moment, and we have to be able to do the contact tracing and get a handle on where the spread is and what we need to do about it. If you don't have those basic ideas in place, it's going to be very unhelpful for you to, you're not going to be able to do much if we don't have those early steps that are taken. And we can't waste time. If we're going to shut down stuff, we got to do it right away. And that's what we're waiting for, some more cohesive, honest policies about what needs to get done.
Mm-hmm. Yeah, and a lot of people are being impacted on a daily basis as we wait. I wanted to talk about the mental health, right? The mental health capacity that the pandemic has had on particularly students, and what resources should we keep in mind that maybe the Children's Health Fund might be able to connect them with?
Yeah, it was a tough question because we haven't had a good accessible mental health services in general for a long time in the U.S.
Yeah.
But if you think about you and your friends and people you relate to, almost everybody that I know is feeling some combination of down, stressed, whatever. And, we don't have much tolerance for the disruption in our normal lives, but here we are having to deal with it. And it's very tough. And some people are going to be able to deal with this on their own, just maybe speaking to friends and family and figuring out ways of having a decently enjoyable time when you're able to. And all these things contribute to a sense of, we're getting with the program here. We're going to learn how to help our children adapt to a crisis and survive and thrive in spite of it. We're going to find other ways of entertaining ourselves, and it could be good, but it's just going to take a lot of effort. And some people who don't have the ability to do what I said and basically pull themselves up, if they're in getting increasingly depressed and so on, then those are people that may need to see a professional, a psychiatrist or a social worker, to help them get through what's going to be a difficult time for all of us.
Yeah, and it makes me think of our public school system and how a lot of students, our mental health doesn't necessarily come into play when it comes to what resources we have in our schools. On a political level, what do you think needs to be put in place moving forward with COVID? It's not going to go anywhere in our foreseeable future, right? It's going to leave a very lasting impact on the mental health of students.
No question about it. And this is one of the things that's covered in that op-ed, the Washington Post that I mentioned. But yeah, I think we have a lot of challenges we're going to be butting up against anytime soon.
Yeah. So I think we can move on to some of the Q&A questions. So someone asked, what will life be like after the vaccine? Does it just go back to normal, or will we have...
No.
No.
There are too many anti-vaxxers who will stand in the way of or convince people not to take the vaccine. And even if they get the vaccine, not everyone's going to be helped by it. So I think this is going to be around with us for a while.
Okay, so how much can we regroup as a country at this point? Would new national policies be able to reduce the virus significantly? I know that you went into this a little bit beforehand.
Well, we should remain hopeful that the vaccine will work, and that it'll work quickly, and that it won't cause other problems on its own. And that said, I think one of the things I've been saying lately is we're going to all have to adapt here, whether we have a vaccine or we don't have a vaccine. This is not going away before 2022. So there's going to be a lot to talk about with this whole episode.
Yeah, and in terms of schools opening again, since it's going to be around for so long, what other things should we be putting in place in our schools to make sure that our students and our teachers are safe?
Yeah. Mm-hmm. In terms of people taking the vaccine?
Or in general, just because I know we're doing remote learning, what impacts that has on students.
So my oldest grandson is a junior at Ohio State University. His younger sister, who's 17, is in her senior year in high school. Caleb, my grandson, went from just being a normal, regular, happily enjoying his college experience and learning a lot. Last year, this has turned into a nightmare where he's sitting in his room doing all remote learning. And if it's in a Zoom type environment like we're experiencing right now, it's tolerable. But if it's just doing modules one after another, it's very tough. My oldest granddaughter, his sister, will be starting school somewhere in the next fall. But what is that going to be? It's certainly not going to be anything resembling the imagined college experience that you had or that I had. But, we don't know what to expect. What will be the situation a year from now? Who knows? So I think there's a lot of uncertainty and lack of clarity. And this is rough. It's a big adaptation process for young people who are still in school and whatever they're doing. But I would say this. I've apologized multiple times to students and young people generally and millennials for the mess that my generation has left. I didn't think I'd ever have to do this, but we're leaving a lot of unfinished business, Carolina. Racism and poverty and lack of access to health care and our inability to really cope with disasters very well. So I'm mentioning this because you guys have to keep up your spirits, because it's going to be about what you're able to do to fix these things. We broke them, and you're going to have to fix them. I wish it wasn't the case. I had high hopes when I was in my 20s that we would end up getting rid of poverty and racism and all those other social ills at the time that were part of and led to the civil rights battles and so on. But we're 50 years later, and we still have a tremendous amount of unfinished business that has to be attended to. So we're leaving you guys a very challenging legacy. So I'll apologize to you also, but this is unfortunate, but this is the way it is. And we need all of you, your whole generation, to be able to think and act and be creative and make the changes that we were not able to do.
Right, and I think an important way to do that is to include youth voice, right, in those spaces, because you mentioned it's going to be up to us to fix these issues, but we're being directly impacted by these issues on a daily basis. My little cousins
Sure.
that are currently in school right now, they can't change the school policies, right? They don't have the political power to say what access they have, what mental health resources they have. So I think it's very important to, yes, say that maybe older generations did create a bit of a mess, right? But
Yeah.
what are they doing now, right? Because I don't see that as an excuse, right? I think that as people in power, they still need to be actively being mindful of the power and the people that are directly impacted, right? Because these are very real people, real lives that are impacted on a daily basis, and it shouldn't just be a problem that we're leaving to resolve a few years down the line,
Sure.
given that children development is being affected today.
That's a very good point, Carolina, because as adults, we can tolerate a lot, and we'll get through it. People have been through world wars and the Great Depression and the Dust Bowl in the 30s in the U.S. But for children who, for whatever reason, are having their educations interrupted, I'm talking about young children, elementary school and before, they lose out now in the continuity and the quality of their education. This is basically sentencing them to a lifetime of being behind the eight ball, of being not able to catch up. So the vulnerability of children and the sensitivity of children to getting or not getting what they need is extremely important. So I think we have a lot to think about here and a lot of work to do, but children are different than other people who are suffering, and in that we can't let them suffer to the point where their futures are going to be affected. And in fact, I'm going to show you something. So this is a book. Can you see this?
Yes.
So this is a book. It's called The Future of Us. This is a new and updated paperback version of the book, and it is about exactly what you're talking about. Why are children vulnerable? What do we need to do about it? And it starts off with a number of stories about children who, for a variety of reasons, are not able to manifest their dreams. And the book starts off with a story about this kid, William, who was a homeless child living in a foster care facility in the early 90s. And I met him I was his pediatrician on one of our mobile units. And I asked William what he wanted to be when he grew up. There's a kid in abject poverty who was homeless and in a foster care system. He said, I want to be a paleontologist. I said, you do? And here we are in the back of a mobile clinic in a bad area of Brooklyn, talking to a kid who has, extreme adversities. I said, how do you know about paleontologists? He said, somebody gave me an article about it, and he reaches into his shirt pocket and pulls out an article from the New York Times from a year before. It was all yellowed and torn and whatever. And this was his lifeline, and he kept it in his pocket as a reminder and as an aspirational idea. But the chance of this kid becoming a paleontologist were in essence zero. And that's what actually made me think about this book, because if kids like William cannot manifest their dreams, that's terrible for him, but it's also terrible for the country, because we need every child to become a success story, to figure out what they'd like to do and not have any barriers in the way. And now we have millions of children who are wonderful and have dreams. They want to be something. And we've created barriers that have to do with racism and poverty and homelessness and all sorts of things that need to be addressed, so that every kid has a shot of, making it to what they want to do. So this book goes through those stories. It goes through a lot of what I've done in my career, but it concludes with a roadmap for how government and parents can help all children in the United States become that success story. We need them to be that for themselves, but also for the future prospects for the United States to remain viable and productive and, advocates of democracy and values, which right now we're struggling.
I want to go back to some of the questions that the audience is asking. So somebody mentioned so far the infection rate at schools in New York has remained pretty low through reopening. How do you feel that's going, and has that surprised you so far?
A little bit, but I don't know what ask me what it's going to be like in a month. I have no idea. So I think much of what we're dealing with COVID is playing a waiting game. More information, more data, more science. There's so much that we don't know about the behavior of SARS-CoV-2, which is the name of the virus that causes COVID-19. And a lot of it's a mystery, and we're just waiting to see what develops and what more we can learn, and that's just where we are.
Right. So how do we get Americans to trust the vaccine? Like you said.
Well, first they have to trust the government, because if they don't trust the government who's promoting the vaccines, then we don't know where to begin. Because the messaging, by the way, around vaccines is very complicated. I've had many, many deeply frustrating conversations with anti-vax parents who, on the basis of garbage on the internet, have decided that if they give their kids even the regular vaccines, for mumps, measles, rubella, the so-called MMR, that their kids will get autism, which is a theory that was promoted by a corrupt doctor who provided some falsified lab results, study results, and ended up creating a cult of anti-vaxxers in the United States and around the world, even though his work was debunked, shown to be not true. It's very difficult to get people, once they've established a belief system, which includes not giving vaccines to their children, it's extremely hard to deal with that.
Yeah, I found it interesting that you said it's important to trust our government, right? But what about communities of color, considering our history with being often used as experiments and just the general distrust that has been created with the government?
Sure. Well, one of the things that we'd like to do is sort of a fundamental idea is that you want people from the community being the communicators. The mayor or the governor at a podium in some place doing a press conference will not be reaching the communities of color and the communities that have been marginalized. And we have to find representatives of those communities who will be the spokespeople to help change behavior in the community. And that doesn't happen often enough, although they're trying in New York City.
Okay, so what could we be doing as a country to make it more equitable and create like a communal sense of trust with the vaccine?
Well, I don't mean to be redundant, but if Donald Trump gets reelected, there's nothing we're going to be able to do. because we'll still have the same bizarre, inappropriate, anti-science leadership, and it's not going to go away. And we're going to have to suffer the consequences. So the first thing is to have leaders that are smart enough and articulate enough and convincing enough to allow people, to people feel confident and will trust them. And that's where it has to start. If we don't have that, we have chaos. We have the American Academy of Pediatrics puts out all kinds of information to families and to children and to pediatricians around the country. There are all kinds of advocacy groups, from the Children's Defense Fund to many, many others. But in terms of broad messaging to people who are resistant or deniers with respect to the usefulness of vaccines, that's a tough challenge. Maybe somebody who's listening to this has an idea.
Somebody else asked, if Biden becomes president, what are the most important fixes that are needed in the Affordable Care Act?
You need to have a public option so that people who can't afford whatever the fees are to get into the Affordable Care Act and its main programs, that we have the ability to make, to allow people into the system through what has been called a public option, which is at low or no cost that allow people to get the health care that they need.
Okay, and just for people who aren't too familiar with what the Affordable Care Act is, do you mind going over that a little bit?
So the Affordable Care Act was President Obama's and Vice President Biden's way of creating a healthcare system that would allow more people affordable healthcare. So 20 to 25 million people have been brought into the system who, before the Affordable Care Act existed, did not have health insurance. Most people in America get their health insurance through their employers. But if you don't have that, you need some way of buying into some kind of system. And that's really what we've been dealing with right now with the Affordable Care Act, which defines what kind of health care people should be having. And it also says things like if you have a pre-existing medical condition, you can still get health care, which is not the case with many private health insurance companies. So it's an effort to open the doors to health care in America, and I think it's done a really pretty good job.
Right. If you were building a public health system for this country from the ground up, what would you do and where would you start?
You mean in terms of programs or what? You don't know. Okay, so yeah. This came from somebody in the audience. Ask them if they have another 2 hours to talk about this, because this is not a short answer. But we want something that allowed people to get into the healthcare system no matter where they worked, or even if they weren't working. We'd have defined benefits that people would be able to get, and they wouldn't be able to be denied access to healthcare because they have a pre-existing medical condition or any other reason. And really, healthcare should be, the cliche is a right. People should have healthcare from birth through death that is not hampered by high costs. And, something like the Canadian system would be fine, but it doesn't matter much as long as people are getting good quality care that they can afford.
And then somebody else asked, if we do have a new president in January, what are the most important things that they can do in order to get us back on track to fighting COVID?
So if Biden gets elected, he's going to have an enormous challenge, Biden and Harris, just reestablishing science as a fundamental reality in creating government agencies and dealing with the environment, with the climate, with the pandemic, and so on. And there's going to have to be a lot of restoration done, including our international reputations, our ability to inspire other people and to create a democracy movement around the country, and then domestically expanding the Affordable Care Act, dealing with the pandemic, making sure that every child is able to go to a good quality school. Those are the kind of things that I would put on the front table.
Would you say that it's important for the community to be directly involved in these policies, in the shaping of these policies?
Yes, yes, but guess it depends on what you mean by involved.
You mentioned access to quality education.
Yeah.
Yeah, could you talk about that?
So, yes, parents and community should have a big say, but it should be tempered with what experts say is needed and how to do it, and what should class sizes be. And there's a lot of variables that we need a partnership of parents, community leaders, and academics to help define what a new education system or healthcare system is actually going to be.
Definitely. So somebody else asked, a lot of medical providers have gotten COVID. Are you concerned about lasting impacts on the profession?
Sure. Especially, I have a son who's an emergency medicine doctor in New York City in 2 different hospitals, and his wife, my daughter-in-law, is working on COVID specifically and the antibodies to COVID. So yeah, I have my children and their children, our grandchildren that are, that's really on the front lines. My son Michael and his wife Anya, and I'm worried. Although neither one of them is particularly worried. They just go to work. They take care of themselves. They're using enough PPE, and they keep telling me not to worry, but I do anyway.
Definitely. How do you feel? How well do you feel that New York City and New York State has responded to COVID in general?
Fine. I think they've, there's certain things they should have started earlier that would have prevented such severe late March and April experiences with COVID. But I think my biggest problem with Governor Cuomo and Mayor de Blasio is that they have these public feuds which are intolerable. And we don't want to hear, testosterone-fueled positions taken publicly where they're criticizing each other and challenging each other about who's actually in charge of this policy or that policy. That is not helpful. It's disconcerting to people. And I wish they would just shut the hell up, basically, and do their business. And if they have disputes or differences in opinion about policies, meet with your staffs behind closed doors and come up with the answer. But public spats, which is the case now with de Blasio and Cuomo, are just awful. They're awful to hear, and they really do impair sometimes making progress.
Definitely. Could you tell us a little bit about what is known about COVID antibodies so far? Do we know how long they last and what protection they provide?
No. So either getting a vaccine when it comes or having the disease itself, we have no idea how long people will have immunity and whether they'll lose it or not, which is highly possible. So it's like we're, again, working in the dark.
Yeah. So how often would you recommend that people get tested if they had, once they test positive and they know that they have the antibodies, what would you recommend?
Well, it depends on what's available. So one of the things I've been advocating for is the emergency use authorization for point of care or point of service testing, where you could, if you're going to go to a haircut or you're going to a beauty salon, that you need to know right then and there that the person who's taking care of you or the people taking care of you are negative. They want to know that you're negative. And it'd be really good if there was just a quick test that you could do when you enter the barbershop, let's say, where they could do the test and know what everybody's status is. That would be very helpful. But if people have symptoms consistent with COVID, they need to get tested every time. If they have no symptoms, it's not known how often they should be tested, but monthly, I'm not sure, but because no one's really established that.
Yeah, and as flu season approaches, what would you recommend for people to do?
People should definitely get a flu shot. Definitely get a flu shot. What they don't want to be is in a situation where the doctors are trying to figure out whether they have influenza or COVID. And so, I mean, my wife and I and our children have gotten our flu shots this year already. Anybody who's not gotten it yet, now's the time.
Just going back to what you were talking about in terms of like rapid testing, do we have access to that kind of testing? Is it available?
No, not really. There's the Abbott company, which made a quick test. I'm concerned about its accuracy, meaning how sensitive and specific is the test. And we still have problems, and I still don't believe their data because it comes from the company itself. But, you know, we just have a lot of work to do, although some people think it's going to be very soon, and we'll have the appropriate testing that we need.
Yeah, hopefully. What about travel? Would you consider it dangerous to get on a plane right now?
Yeah, there's been some publicity recently about some studies, one of which was done by United Airlines, on how and why it's safe to do air travel. I don't believe it. And a lot of my colleagues don't either. It's sort of poorly designed studies, and I don't think it's really telling us much.
Okay, why do you say that you don't believe it?
Well, first of all, if companies are doing something that will be in their own financial interest, for example, getting people back on their planes, I think the temptation to make the data look better than they are is always there. I just don't believe them on principle. On the other hand, I do believe that there's plenty of room for research that will involve, you know, public sector scientists and public health labs and so on, academic labs, and all that should be done.
Yeah, and somebody from the audience also asked, how can we make Americans understand that investing upfront in healthcare and other services saves public costs down the road?
We? What do you mean? Who's we?
I guess as a society, how do we encourage people to invest in healthcare? Why we need to invest more?
Well, citizens have zero authority to make decisions about what we invest in, except for this one thing, which I've said a few times: vote for people who agree with what you're saying. That's it. That's what you got. I mean, you could write op-eds, you could do all sorts of other things, but in terms of actually having people in office who believe the same thing you do about a quality education for all children, access to health care for all Americans, you need to vote for candidates who promote and are attached to those particular agendas. If you don't, you're going to be doing a lot of sign carrying and letters to the editor. That's not going to amount to much.
Well, I don't know if it wouldn't amount to much. I think that protesting and writing about your experiences is a very valuable way. You know, like not everyone does have the right to vote, right? Because not everyone has the right to vote, and I think it's very
but how do you know
important
that writing letters and carrying signs makes a difference?
I know that it allows for communities to rally around a cause and organize within each other, because a lot of the issues that they experience are often overlooked. These are not new issues, right? And like the communities know what they're facing the best, right? And
I think I'm sort of pushing you on this because one is I'm old and skeptical, and I've been through a lot. I've been through, I started working in 1971 after my training in pediatrics, and I was a child of the Kennedy-Johnson era, meaning that I believe in activism, and I believe that big change was possible. When I was of age, I witnessed the development of the Civil Rights Act, Medicare and Medicaid, et cetera, and all sorts of things that made me feel confident, including John F. Kennedy in 1960 saying, we're going to build spacecraft and we're going to send people to the moon and back within a decade, which was a preposterously outlandish thing to say, except we did it. So I grew up in an era where making big changes and doing big things seemed possible. But then in the 50 years after that, we've had lots of failures, including the inability to end poverty or to provide everyone with access to health care. And it's been very difficult, but we've had Democratic and Republican presidents and Democratic and Republican Congresses. And it's just very difficult to make change. And the value, really, seriously, of communities protesting and writing is to have their political leaders think that the community wants change. We want access to health care for everybody. So if you, Mr. or Miss Congressperson, want to get reelected, which they all do, then you will listen to the community. So it depends how strong your voice is. And yes, there are certainly techniques that will make your representatives sit up and take notice. But there are also people promoting other ideas. We don't want the government intruding. We don't want you telling us what to do. So it's a question of, it's really a power equation, whether the people who want the kind of change you're talking about are strong enough to threaten the positions of our elected officials. And if you are, and this is supporting what you're saying, and if you can create that sense, then that's good. But I think at the end of the day, if you don't have people representing you in the state government or the federal government, it's going to be very difficult to get the change you want. So that's what I'm saying.
Yeah, and I think that's exactly the problem, right? We don't have people representing us, right?
That's the point. It's members of Congress are extremely sensitive to letters from their constituents. So if you get 10,000 people writing to your member of Congress saying this is what you'd like, that's a big impression. In fact, 5 letters could make a difference. But if you have 2 or 3 times that number, or even the same number of people writing for something opposite, that's a problem. So we have to elect people of principle who are responsive to their communities and smart enough to know what the right answer is. So I'm just slightly just pushing you because I'm after many years of experience, I'm just telling you, making change is really, really hard. Even with Obama, who I was a big fan of and campaigned for and whatever, he decided to go for the Affordable Care Act as his first act. And then Mitch McConnell, the Senate Majority Leader, said, yeah, well, I'm going to spend the rest of my time in the Senate keeping you from accomplishing anything. He basically said that overtly, not in veiled language. He said, this is our Republican agenda. So as opposed to doing whatever, writing letters to the editor, as a New Yorker, we should have maybe, and I'm saying this to myself as well as to you and the people that are listening in here, maybe we should all have gone to Kentucky 6 years ago when his last term was coming up and created a groundswell of voters who would have voted him out of office. And I guess I'm trying to talk about my own personal conflicts about what to do to make change. It's not easy to do. But I was saying about Obama, who I adore, and he was just out campaigning for Biden yesterday. And I guess we're going to see a lot more of him in the next week and a half. He's an incredible politician and leader and inspirer of people. But anyway, he decided to do the Affordable Care Act first. And he ended up doing not enough, as far as I'm concerned, about poverty for families and children, about racism, about a number of other things that maybe he could have. So I've also been chronically disappointed for the last, half a century, but that's not your fault. But that's, it's just the perspective of somebody who's been around for a while, very deeply immersed in all kinds of problems that end up being called the social determinants.
Yeah, so do you think anything fundamental will change in American healthcare as a result of this pandemic?
I hope so. But I know I'm being redundant. If Trump is reelected, it won't change. In fact, it'll get worse. They're in the Supreme Court right now trying to get the Affordable Care Act deemed unconstitutional. So, and then he's appointing, Supreme Court justices left and right. So if he wins, I think we're going to be on a big, fat, long pause in terms of making social change. Unless, of course, we Democrats win the House and Senate, and I think that would be good. That's the second choice after, electing Biden.
Okay, and then somebody else from the audience mentioned, how are we doing on COVID treatments once a person gets sick?
Yeah, so the number of things that we do. First of all, the survival of people who get hospitalized for COVID is improving. We're getting a lot better at taking care of COVID patients. We have a couple of experimental drugs, one called remdesivir, and the other something called monoclonal antibodies. And then we have these high-impact cortisone, steroid-type drugs, like dexamethasone. So we're getting better. So the survival of people with COVID who have gone in the hospital or even gone to intensive care units is really much better than it had been. And that's a good thing.
What have we learned about who is most severely impacted by COVID? For instance, sometimes somebody heard that men are more at risk of a serious infection. Is that true?
Yeah, I think the biggest disparity is between, minority Black and Hispanic populations, of people who live in poverty, and others who are not Black and Hispanic, who don't have, an overabundance of pre-existing conditions that would make them more vulnerable to getting very sick. So we have disparities that are very important, and that is something that's really intolerable.
Definitely. I want to say the last question is, will COVID naturally get weaker as time goes by, and do you see any evidence of that already happening?
What happening of it just disappearing?
COVID naturally getting weaker.
I don't actually see that. And it could end up being what's called endemic. So a pandemic is an infection everywhere. An epidemic is a more localized outbreak. And endemic means that, let's say, the SARS-CoV-2 virus, which causes COVID, becomes just part of our environment. And then we'll have to get vaccinated every year, or maybe a vaccination against it will go into the annual flu shots. But it's just possible that it's going to be lingering around for the foreseeable future, unfortunately. I don't know that. I'm just saying it's a possibility.
Definitely. Do you have any other comments that you would like the audience to know?
No, I think it was great questions from you and from the audience. And I think we covered the waterfront there, and we are dealing with a very tough problem with a lot of unknowns, and we have to, tackle it seriously.
For sure. Last question. Can we bring this down to a micro Goddard level? Should Goddard Riverside be providing services outside of its normal suite of services in recognition of the pandemic?
That's a very good question. I'd have to think about that. Yeah, the answer is yes, but what specifically could you do? There's probably a lot that you could do, both in the local community and the community at large, but that we should talk about another time, because I think there are things that could and should be done. It's a great program, and it really ought to be explored as how your program, but also programs like you, can make a difference.
Yeah, there's definitely a lot of people impacted and served by Goddard. I don't know. Do you have anything quick that you'd like to mention? Because I know that a lot of the people watching are affiliated with Goddard. So what would you recommend?
About what Goddard can do?
Yeah.
Yeah, so that's what I'm saying. I'd like to not just come up with something out of the blue here, but if you're interested, I'd be happy to continue to be engaged with Goddard, at least in terms of trying to figure out what it is that you can do and how that could happen. So, but I think the answer is yes. That would be a very useful thing to engage in.
Okay.
the process of trying to figure out what would actually be feasible for you guys to do.
Mm-hmm. Okay, well, that was it from the questions from the audience and from me. So thank you so much for.
Oh, my pleasure. It was really, really great. Time went by quickly, and I think you have a great program. I'm glad you invited me.
Everybody, please join me in thanking Carolina and Irwin for that incredible discussion. We shared the resources that Dr. Redlener mentioned in the chat, and we'll also send those links out when we share the recording as well. I want to thank everybody for joining us this evening, and I hope that you'll join us next Thursday for the gala. Thank you.
One other thing I want to say
is, please.
If people end up getting this book and you write a review of it, I would like to post every review that I get. And because this book will stimulate some thinking and conversations, perhaps, and I'd like to know about it. So I'd consider it a two-way street. But anyway, thanks again for having me. And I would like to follow up with Carolina's last question about what Goddard could do. If you're
Absolutely.
interested,
We would love that. Yes.
Let's do it.
Yep, we would love that.
Great, guys. Thank you. Have a great night.
Fabulous. Thank you all.